Dr. Jenny and welcome back. Today we're going to discuss a condition called lymphedema. Last week we talked about lymphatic vessels and why the lymph nodes are important. The lymphatic vessels, as you know, transports fluid that are sort of accumulating in the tissue. And the lymphatic vessels bring the fluid back to the heart, and in the process they pass through these lymph nodes. The conditions that disrupt this normal lymphatic flow can cause fluid to accumulate in the tissue, resulting in swelling of the affected limb. This buildup of lymphatic fluid is called lymphedema. Once lymphedema occurs, the swelling may increase if it's not treated promptly. Lymphedema is most often develops in arms or legs. It can also affect one side, but it can involve both sides. It can also involve the chest, back area, neck and face, and abdomen, and pelvic regions if it becomes severe. There are two types of lymphedema called primary and secondary lymphedema. Primary lymphedema is caused by malformations of the lymphatic system. This can be present at birth or may develop later during pregnancy or during puberty. It's most common in the legs. Secondary lymphedema is a result of damage to the lymphatic system. Surgeries such as mastectomies, lumpectomies, which take lymph nodes out, are most common causes of secondary lymphedema. Secondary lymphedema is most common in the arms. Lymphedema usually starts with subtle swelling. It can feel like tightness in the affected area. Women usually start complaining that they can't wear rings anymore in their fingers because of swelling. The thing that's important about lymphedema is that once it starts, you need to let your doctor know right away, even if it's very subtle, because if you treat it early, it's a very treatable condition, but if you don't, then it can progress and it becomes very, very hard to treat, and that's why you see some of these women who've had breast cancer and lymph node dissection end up with these huge arms that are very cosmetically not, what we want in terms of breast cancer treatment. The lymphedema treatment includes, usually starts out compression garments such as stockings or arm sleeves that people can wear, and what that does is it puts external pressure on the affected arm or the leg, and it helps push the fluid back to the heart. But the ones that are real severe, there are people called lymphedema therapists, and what they can do is they can perform manual drainage techniques and exercises to decrease this swelling. There are also pneumatic compression devices, or kind of like air pumps, that can be used to push this fluid back into the circulation. It's also important to know what ways you can prevent lymphedema from starting. And it's important to take these precautions if you're a breast cancer survivor, so we don't end up developing lymphedema. Repetitive motions like exercises, infections, cuts, and trauma to the affected limb can increase your chance of lymphedema. So if you're at risk and you've had lymph node dissection and you don't want to develop lymphedema, you need to start wearing protective gloves when you're doing different things. Even if you're gardening, you need to make sure you wear gloves so you don't, prick your fingers or cut it. Because that will all complicate lymphedema. Also, if you're going to the hospital or doctor's office, make sure you tell them you have lymph node dissection there and they can't do any type of blood sticks or IVs there, because that will aggravate the condition. Also, if you're going to a nail shop or and get your nails done, it's important you tell them not to cut your cuticles when they're trimming your fingernails, because that puts you at risk for developing lymphedema. And when you're shaving, make sure you don't cut yourself in the affected area, because that's also a risk factor. Also, avoid wearing tight-fitting clothes that can sort of deter fluid circulation. And also, if you carry one of these big purses that may be fashionable, and you put a bunch of stuff in it and it's heavy on your arm, that can decrease fluid circulation, so you don't want to do that. Also, gaining weight is bad, so you don't want to start gain a bunch of weight, and that can make lymphedema much worse. And also you want to cut back on type of foods that has a lot of salt, because as you know, salt makes you retain fluids. Drinking alcohol can also worsen the swelling. If you lift a lot of weights when you exercise, that can also worsen lymphedema. Therefore, if you have lymphedema, or if you think you're developing lymphedema, then you need to talk to your doctor immediately and start seeing a therapist so they can treat you, and so that you can avoid lymphedema becoming much worse. Thing about lymphedema is early detection and treatment, because just like anything, if you can detect it early and treat it early, you can get the best results. This is Dr. Jenny Yoon. See you next time when we start discussing a condition called fibrocystic condition and causes of breast pain.